Hi, we are at Health with amazing founder, and he's actually in the stealth mode, but he promised for us specifically to tell us more about his startup. So please tell us who you are and what you do.
Yeah, my name is Micah Friedland. I'm the founder of Navi. Navi makes sure that everyone who needs access to mental, behavioral, or developmental healthcare gets it. In practical terms, what does that mean? It means a 15-minute phone call with one of our navigators gets you an appointment with a therapist, psychiatrist, ABA, speech therapist. Usually that's within 5 days. So think about people who are looking for care for months for their child, for themselves, can't find someone who takes their insurance, treats their condition, has availability. Take that 15-minute phone call and it's solved.
Sounds amazing.
Thanks.
Why no one is doing that?
So
it's like a very important problem.
It is an important problem. There are a lot of amazing mental health companies who are trying to solve parts of that by increasing access, whether it's virtually, in person, increasing coverage. The problem is, though, in healthcare, it's so fragmented that as long as you are providing care, you're going to be limited. So the analogy I like to tell people is think of airlines. No airline flies out of every single airport, large and small, nor do they fly directly to every single airport. So that's why we have layovers, and sometimes you're flying at crazy times and hours, and sometimes you fly Spirit versus United versus Singapore, and because of that, there needs to be an aggregator of all the aggregators, and that's what we do. So we work with partners that have 20,000 therapists, some that have thousands, some that have hundreds, some that have just a few dozen. But because we do that, it allows us to, regardless of anyone's needs, we can find someone.
I assume you know the space really well right now. What is the biggest challenge right now for the startup?
So the biggest challenge in, I think, mental health in general is pediatric mental health. I think a lot of those companies are struggling just because there's so few providers. In mental health in general, the margins are not there. And what I mean by that is, if you're seeing a traditional MD doctor, they are having 15-minute sessions, billing way over $100 for each session appointment. With therapy, you're booking 45-minute sessions, so basically a full hour, and they're charging or billing insurance $100 to $150. So you're only able to even capture every hour a third or a fourth of what a traditional doctor does. And then when you have these mental health companies that are sharing that, you're sharing a very small percentage versus being able to share like a lot of margin. And because of that, it's just really hard for them, even at scale, to be profitable, which is kind of frustrating because we want them all to succeed. So it's difficult, yeah.
So we're at Health. Your main purpose coming here, finding more clients, investors, just building a relationship.
Yeah, we're a purely relationship-driven company, right? We can partner with any digital health company or any mental health company to either help their members get care or help bring patients to them. And what that means is payers, hospital systems, doctors, or a digital health company that needs to offer a mental health offering, we can do that. We plug and play with them. We're free. Our setup time takes under an hour, and we can immediately start helping their patients. On the mental health side, it's also quite easy. Post signing a contract and figuring out what they need, we're able to start sending them patients ASAP as well. And so our goal at Health and conferences like this is how can we build as many partnerships and relationships as possible?
Well, I'm really happy to see you again.
Yeah, always.
And excited what's coming next for Navi. Thanks, Ben.